Hi, good evening, everyone. So today, after discussing what are the factors that upon which we decide that which route of drug administration would be the significant or would be the suffice, and depending on how the drug, what are the changes that drug goes through in our body, we now come upon to understand what are the different routes of drug administration. So simply, the title itself is self-explanatory that we are understanding what are the different pathways through which we can introduce different types of drugs into our body so that they can show their effects on the target side. After understanding this one, you would be able to understand that if you know about the drug properly, that which route should I give, what would be the reasons behind giving that route, how should I give the medication through that route, or what would be the importance, and what is going to happen to that particular drug inside the human body, right? So moving forward, the major classifications of different routes of the major routes of drug administration are enteral and parenteral. So we will go through them one by one, and then there are some other routes of drug administration as well that are external as well as internal as well. So we'll go through them in our whole video today, in this video today. So moving forward, first route is enteral route. So what does enteral route exactly means? Enteral route basically applies to those routes of drug administration which requires the drug to pass through the liver so that it can get metabolized. Right. So, for example, when you want to make sure that the drug reaches its target site, you need to make sure that it is distributed well inside your body after being absorbed. So if it needs to be distributed properly, it needs to go through the systemic circulation. But before reaching the systemic circulation, it needs to get metabolized into its active form, right? And there are a lot of byproducts that are generated when the drug is in our body. So when your drug goes through that ADME process and for metabolization, it goes through liver. It is known as enteral route. Basic thing is that it's going through the liver, right? So, what are the advantages of such routes of enteral routes? First of all, enteral route is easy to administer. The patient isn't hesitant to take the medication. They can self-administer the medication. You can take a tablet by yourself. You do not need a nurse or a doctor to help you in taking the tablet. You can, with the help of yourself or your family members, can take it. There's no professionalism required in that, professional help required in that administration. Thirdly, third advantage is if there's any toxicity or adverse effects, major adverse effects that are occurring due to that particular medication. So it is very easy to reverse those toxicity or adverse effects. Reason being, first of all, it takes very long for a drug through enteral route to show its effect in the body, right? So it shows its effect slowly. So if there's a toxicity, you would come to know that yeah, the person is having some toxicity or adverse effects to this particular medication. Let's start an anti toxic medication for the same patient. Secondly, the bioavailability of the enteral route medications is low because you are taking the medication, for example, 100% of it. Some percentage of it, for example, let's say 30% is lost during the absorption process because the medication is reacted upon with stomach acids. Then it's getting distributed. So not all of the drug would be reaching the drug site, would be reaching the target site. Most of it, some of it would also be going to other parts of the body. That's why sometimes you see cetirizine or paracetamol or different tablets are causing other problems to the patient as well, and that is known as adverse effect, or you can say side effects in some cases, right? So the bioavailability is very low, so the toxic concentration or the concentration of the medication that is causing that adverse effect or toxicity is low as well, so very easy to reverse the effects that are being caused due to that drug, the negative effects that are being caused due to that drug. So these are some of the advantages of these drugs, right? Now the second is disadvantages. As we mentioned, that bioavailability is not 100%. Some of the bioavailable product is being lost during absorption, some is being lost during distribution, some is being lost during the metabolism part, right? And the others are getting discreted. So the patient is not able to get the full amount of drug that they need to treat themselves, and hence the total treatment is not being established. Sometimes that is why you see that a patient who is taking an antibiotic course is going on antibiotics for 5 to 7 days normally, and even for weeks usually, rarely, right? But a patient who is taking antibiotic course through intravenous routes is going on an intravenous route dose of 1 or 2 times only, and that is enough, because the bioavailability in intravenous route is high as compared to the enteral routes. That's why they need to administer the medication again and again, so that a good amount of medication is reaching the target place or target organ or target site and showing its effect. Due to low bioavailability, we need to make sure it's given again and again to make sure appropriate tissue concentration is being reached, right? Secondly, disadvantages. For example, one of the examples of enterobacteritis is having tablets. Now tablets can be chewed, right, and can be swallowed, but for elderlies it is very difficult to swallow some medications, right? So they wouldn't be able, because it feels quite uneasy to swallow medications, especially big tablets, paracetamol tablets. They are quite big inside, so they become uneasy to swallow, difficult to swallow. Similarly with children, it is difficult to administer children's any oral tablets, capsules, or any oral medication, especially syrups, being non-palatable, not good in taste. Remember, you used to have cough syrups and they used to taste gross. So that's the thing. They are not good tasting, right? So the adherence is not good. So these are the disadvantages as well, right? Moving forward, types of enteral drug administration, there are usually two or three of them. First is oral, as we discussed. You take a tablet, take a capsule, take a liquid syrup, and the tablets are of two kinds as well. One is the, like, you take one tablet and it will show instant effect, right? For example, paracetamol, if you take 500 milligrams, it will show you instant effects. But there are some paracetamol formulations in tablet only which have extended release, right? So you take that medication and it will in slow amounts will release your pain for a longer period, so it will continuously release your pain. Similarly, there are other medications. For example, you can take medication for nausea. There are medications which can have one and it will show instant anti-emetic effect, but there are other medications within the same with the same ingredient but formulated in a different way that you take orally, similarly to the previous way, but it's going to show its anti-emetic effect for a longer duration. So those are known as long acting tablets or extended release tablets, right? Now second type of enteral route is sublingual. So sublingual, as you can see in the diagram below, so you put the tablet below your tongue and the tablet releases its content or its main ingredient through the sublingual route, which is get absorbed through sublingual route and gets inside the stomach and shows its effect by absorption, distribution, metabolism, and elimination. And third is buccal cavity. So buccal cavity is the cavity that is on the inside part of the mouth, but similar on the cheek. So this is my cheek. The inside part of the cheek is known as buccal cavity. So you put the drug on that one and it's slowly released. For example, there are nicotine chewing gums that are used for the same purpose. You take the chewing gum and you chew it, and you then put it next to your cheek in the inside of your mouth. It slowly releases its nicotine content, providing you the nicotine craving that you are getting, to make sure that you get abstinence from smoking cigarettes or vaping or anything that you smoke, right? A person smokes. So these are the three different types of enteral drug administration, right? So examples, paracetamol is a normal example. Nicotine is an example that I've given you. There are sublingual tablets that you can put in below your tongue, and it will release its substance and you get the effects that you want, right? Moving forward, the other route of administration is parenteral, which is the second major route of drug administration. What does parenteral route means? As enteral means passing through liver, right? Going through liver. Parenteral means bypassing the liver. That is, the drug is not getting metabolized in the liver, so its bioavailability becomes high, right? Because we are going to give the drug at the target site. So one of its advantages that the drug is 100% bioavailable at the target site and shows its activity 100, their activity is 100%, because we are directly giving the drug to the target site. So what are the pathways that the drug is not following in the parenteral route? First of all, it does not need to get absorbed in the stomach, right? So it is not getting acted upon by the stomach acids. So bioavailability loss is saved first there. Second, if you are giving any parenteral routes are majorly injections, right? So if you're giving any injections, most of the time you're providing the drug at the target site, right? So distribution is there, but more of the distribution would be at the target site and not at any other site or tissue. Third thing, the drug does not need to get metabolized in the liver. So bioavailability is saved again. Fourth, excretion is to be done, but first, because the bioavailability is saved, a lot of drug is available to be acted upon and show its effect on the target site and then get excreted. So that's why those are the advantages of this parenteral route, right? It is very rapid acting as well because this does it is not going through those ADME processes or pathways. So parenteral route shows its advantages or its effect quite soon, quite rapidly, right? So if a patient is not is, that wants an emergency has wants an emergency treatment, you can give them parenteral route. Third thing, for example, the patient is not conscious, right? They are not able to swallow, you're giving them and they're throwing out the tablets, you can use parenteral route. You do not need to make sure that the patient is taking the tablet and it's going into the stomach and showing its process after half an hour, 1 hour. You can simply inject them when they are not conscious. It also makes sure that the conscious patient does not get anything stuck in their throat and block their airway, making them leading them to death due to airway obstruction, because you needed to provide some medication. So giving them parenteral route would be an easy option, right? Disadvantages, as we discussed with the enteral, toxicity was less and easily reversible cause the viability was low. Here in parenteral route, the viability is quite high, around 100%, not exactly 100%, but between 95 to 100%. So the toxicities would be high as well. And because it is a rapid acting, so if there are any toxicities with the medication to the patient, then the toxicity would be quite rapid as well. So it becomes irreversible or very difficult to reverse those toxic effects. So we can say it causes an irreversible action, and if it's a toxic reaction or adverse effect reaction, then it would be difficult to reverse it as well. So this is the major disadvantage. Second, it people are quite scared of it. Like taking up injection, sharps seems scary as well. I am myself scared of it, right? So what I do when the person or the nurse or the doctor is injecting the needle to take my blood samples or inject something, I do a cuff. So cuff doesn't makes me feel that something is going inside me, takes distracts me from the needles, and it's very easy to accompany the person who is trying to take your samples or inject you some medications as well. So that is one of my tricks you can try. But sharp needles, seeing them is also disadvantage. Right. Third thing, because those needles are opening a pore in your skin, right? So there are chances of infections, right? If it's a venous, something you're taking a blood sample, then those veins are infiltrated. There's a pore in that one, and we have microorganisms even on our skin as well, which could be lethal if they go inside. So that would be not beneficial for us. So it can cause infections. If the injection is not injected correctly, it can cause harm to the cells, right? To the tissue around there. Sometimes the drug might not be the drug is not suitable for veins or my skin, and I inject it. So it can cause necrosis or death of my cells around that place. So these are the some of the disadvantages. But the major one is you need to make sure that the patient pore is closed. That's why first your skin is sanitized around the area where you're getting an injection, and then then you are injected with medication, or your blood sample is taken, and then they put cotton around it, around the pore they made, so that microorganism chances of microorganisms infiltration is less, which makes your chances of getting in sepsis or any sort of infection less as well. That's why they make sure, right? What are the main types of parenteral routes? So there are four main types, as you can see on the diagram as well. Intravenous, which is one of the majorly used ones. Intramuscular, which are used to inject in the muscles. Subcutaneous is the layer that is below the dermis but is a skin layer, so in the subcutaneous tissue. And in the intradermal tissue, it is the layer just below the epidermis. The epidermis is the skin that you are able to see. Below this skin is the dermal layer. Below this dermal layer is a subcutaneous layer, usually consists of fat as well. And below that subcutaneous tissue is the what we say muscles, right? Now we know that intradermal would be working below the epidermis, subcutaneous would be working below the dermis, and intramuscular would be working below the subcutaneous. Then where would be intravenous would be working? Intravenous, as you can see, is working on the veins. It is not working on a skin cell, it is working on the veins, in the veins, right? So intravenous is directly into the veins. One more thing, dermis layer is one of the vascular layer in our skin. S- So you need to make sure that that's quite vascular. So you need to be careful. You might be planning to inject it in the dermis, but might inject it somewhere else, right? So to make sure that we are injecting at the correct layer, we use some angles, right, to make sure that the needle at the end is injecting the medication at the right layer, right? Muscle is the last layer, so we need to make sure the needle goes as inside in the body as it can. So we use the 90%, right? 90% it's going straight inside as far as it can go, right? Difference in needle size length also impact the injection of a medication, injecting a medication. But we make sure that it's 90-degree so that it can go as much inside the skin layers as it can. So through the epidermis, dermis, subcutaneous goes into the muscle. So that's 90-degree for intramuscular. Then we use subcutaneous tissue because it is just above the muscle layer. So we make sure we give a 45-degree, right? That makes sure that the medication is getting injected in the subcutaneous. Then we got intravenous. So if we give injection by 25-degree, we are getting it into the veins, injecting the drugs into the veins or getting the samples from the veins. Then we got intradermal, which is 10 to 15. I said the second layer in our body, which is just below the epidermis layer or your skin. We inject it at a very less angle, that's 10 to 15-degree. Now the thing is, you have seen that a nurse or doctor were trying to gain your blood samples from your veins. Just tap your hands, and they are able to see your veins, and you are able also, as well, to see your veins, especially on your hands, on your arms. So they can inject it directly there, right? But sometimes you're not able to see the site where you want to inject, right, the medication. So you use those angles. So I'm not able to see my muscles from here, the exact muscle cells. So I do it 90-degree so that I'm sure that injecting it at 90-degree fully would inject the drug into my muscle cells. Similarly, I cannot see my subcutaneous. I will administer an injection at 45-degree to make sure it's going into the subcutaneous. With veins, I will make sure I know that the veins are seen. I can see the veins. But above the veins, there might be dermis layer, right? Or I might be injecting in the epidermis only. So I see the veins, I see the veins, and I inject my drug at 25 degrees Celsius. Because I'm seeing vein, but the drug might be going into the epidermis. So making sure the angle is 25-degree, you inject the drug directly into the veins. And similarly goes for the intradermal. Now, with practice, when you practice injecting medication, it would be easy for you to inject medication. As you can see in the diagram below, and you might have got your vaccinations, COVID vaccination. So they used to hold it like a pen and administer your COVID vaccine on your shoulder like a pen, like this, on 90-degree, right? Similarly for intravenous, intradermal, you can see the hand movements, but you need to practice those in your course so that you are aware that how to use it. You will be confident with that. You just need to be confident with injecting medications at the right angles, right? You will not be going and measuring the angle to the patient. You'll become confident in injecting at those angles by knowing, okay, if it's intravenous, I need to introduce like that. If it's muscular, I need to go like that. That comes with practice. So let's have a good look or a thorough look over different types of uh, parenteral routes of administration, drug administration. So intravenous, as you mentioned, directly into the veins. Angle of injection is 25 degree, right? And specialty is rapid acting. So if you want a drug to be acting more rapidly, as fast as it can, then give it by intravenous route. You just need to make sure that the drug is not irritating to the veins, yeah, or to your blood. Usually, intravenous is given as a single dose, like the whole medication is delivered instantly, and it is known as intravenous bolus or IV bolus, short form, abbreviated as IV. Intravenous is abbreviated as IV. But if you want to provide drug over a long term, as we got extended release in enteral oral capsules or tablets, we got extended release medications in IV as well, and we call them as IV infusions. So you got infusions and bolus as well, which is giving the medication at the same time. Next comes the intramuscular. So intramuscular are used are a different type are used when a different target of action is required. So if you want to provide medication at intravenous route, you wouldn't go for intramuscular, right? But if you want to provide medication at intramuscular in your muscles, then you wouldn't go for intravenous, because if you want to provide medication in your muscles, and intravenous is a rapid route, it's the most rapid route. IV is the most rapid route, so you wouldn't be going for IV because it's more rapid. You will go for IM because you want to provide it to muscles. That's our target site. That's into the muscle. Angle, we know 90-degree. Specialty, there's no specialty about it. You can give drug to the muscles. The only thing is it is also in two formats. One is directly acting, instantly acting. You give a normal IM. Secondly, they come in specialized depot formation. So you give the medication into the muscles, and those medications are embedded or mixed with as a solution with non-aqueous solutions. So when you provide it into the muscles, the solutions, the aqueous solution, non-aqueous solution, diffuse out of the muscles, which allows drug to show an effect, a slow release. So extended release or slow release, similar to tablet or IV infusion, but at a different site and with a different name, right? Moving forward, we've got subcutaneous, which had an angle of 25-degree, right, or 45 degrees below your dermal layer, right? And into the subcutaneous tissue, angle of injection, we just discussed 45-degree. Specialty, some drugs are not suitable to be administered into the intramuscular or intravenous route, right? So their target of site becomes a subcutaneous route. There are not different type of subcutaneous route, got like slow release or fast acting. Just introduce the drug into the subcutaneous tissue, and that's all, right? For drugs that are not good for introduction in intravenous or intramuscular routes. And last one is the intradermal with an angle and injection of 10 to 15 degrees. It's in the second layer, and most of the products used for desensitization or to find out something inside the body are introduced through intradermal route. So this is intravenous, intramuscular, subcutaneous is mostly used for administering a drug. That's a drug route administration. Intradermal is not mostly used for a drug administration route, but mostly used for imaging routes. Like you inject some iodine or any other, not iodine exactly, but some metal compound or desensitization compound into the intradermal route to have a good view of image of that particular part in the body. Now, if you've got substance that's not good, that's irritating to the tissues, you wouldn't introduce it through intradermal or subcutaneous tissue. You would go with IM or intravenous because it's not good with your cells, just skin cells. That is subcutaneous and intradermal. So you need to make sure. There are a lot of substances that are not good with your tissue and causes tissue necrosis. So we wouldn't be giving them through intradermal or subcutaneous route. Right? We can give them by intravenous route. Now, all of these, they carry disadvantages, which we discussed earlier when we were discussing about parental rules, not reversible, right? Advantages is bioavailability is high, rapid. Now, when we say rapid, out of 4 parental rules that we've discussed, intravenous is the most rapid. Make sure, right? Now, there are other routes. First of all, why do we use other routes? We'll discuss this one later, but let's first discuss what are the other routes. Oral inhalation or nasal preparation. When you get congestion, right? So you use those nasal sprays. People who have asthma or COPD, they use salbutamol to open their airways, and steroidal medications through inhalational route to make sure lungs are getting that medication and inflammation is relieved, right? So why are we using oral inhalation and nasal preparation? First of all, it is directly acting. You do not need to eat a tablet, wait for some more time to show its effect, get less bioavailability and get an effect. With nasal preparation, within 5 minutes you get unblocked noses. Similarly, with salbutamol, it usually takes half an hour, right, to basically open your airways. So rapid acting with less toxicity. A person who is using like salbutam preventer for months, can they take it through oral routes? It would be more toxic as compared to the inhalational route, right? So sometimes it's more effective to give it and more direct than giving it through oral or intravenous route, and more easy as well. Directly we can give through intra uh, perinoleal, in not perinoleal, intra routes as well, like parenteral routes as well. So we can directly inject into the lung, but that's a hassle. A person who is getting a panic asthma attack wouldn't have time to go to a doctor, get an injection done. It would take time for them. So use having a puffer, using oral inhalation to provide that medication would be much easier, much convenient, less toxic, more rapid, more direct, right? Second is intrathecal. So these medications are parenteral only, but they are directly given at the inject at the target site. I've got something in my heart. I want a medication for my heart. Rather than going through these venous routes, I will directly give it to the heart. Less toxic again because you're getting more viability at the target site. So more bioavailable, more direct. Similar to the previous one, right? But disadvantage is there, opening is being made to infections, cell necrosis, right? Fear is there. Topical, when you get anything that's on the skin, that's on your epidermal layer. Now we've covered all the layers. Now it's the epidermal layer. You use topical application. You got fungal infections on your skin, use a topical antifungal cream. You got any inflammation sort of a thing, you use steroidal creams, right? So these are topical applications which you apply on your skin. It is less toxic, more rapid, more relieving, and more soothing to the skin. Directly acting as well. Though you need to apply it for more time and it penetrates your skin less, so obviously less toxic if we discuss that one. They don't show any adverse effects. Very rare that they will show you an adverse effect until unless you are allergic to the substance. Transdermal, basically they you put a patch. It's like a patch, mostly come into pain and nicotine withdrawal, right? So you put a patch and the medications are released from that patch into your systemic circulation. So people who don't want to swallow or who don't adhere with their medications or don't want to take an injection, this is a good way. Long term effects like slow release ones, these are slow release as well. You do not need to remember, you just put a patch, sleep. Some people don't find eating medications or injecting medications good. They're not compliant with it, they're not happy. At the end, it's the patient's decision. If you want the patient to be treated, you need to discuss them the options through which they can get the medication into their body. If they don't like oral, they don't like injection, then you cannot treat them. You need to provide them all the solutions that you have to introduce the drug into the body, and they can select which one is easy. I don't like to swallow drugs because it feels uneasy when swallowing, and I don't want the injection because I'm scared. I wouldn't be adherent to the medical treatment that you are providing. You would say, okay, you'll come, this is only one injection. I will say, okay, let's book an appointment, and I might not show up to the appointment. I'm not being treated, right? It's getting worse later because I don't know, you know it, it's getting worse. I think, no, I'm safe from the injection, right? But you need to make sure the first time that a patient is happy with the administration route and the disease treating program that you have devised for them. The transdermal can be used as well. So you can put the transdermal patch. It would be easy to patient because they don't need to remember to take their medications, and you just put a patch. Just make sure that they don't put it on a hairy area because it would be difficult to them and very painful when they get taking that patch off. So they should clean it, right? The area of the skin. And rectal is in through the anal route, right? So when usually used for patients who have difficult swallowing and usually get suppositories right? And contraceptives through that route, rectal route, copper T and all those. So when medications taking taking oral medications or intravenous medications becomes harmful for the patient, they're not able to, because they're old or they are quite small and they're throwing up medications and not being adherent, then use the suppositories or copper tier dose substances, so that the patient doesn't have to adhere with the medication, do not have to remember to take them regularly. Less toxic, easy way. It's mainly rectal route is mainly used because patient is not taking the oral route. Okay, most of the routes in these other routes thing is being used so that it becomes less toxic. So why other routes are being used? So that it becomes less toxic for the patient and easy to use it and more direct. But the rectal route is being used because the patient is not able to take it through the oral route. They don't want to, or they don't want to make sure, they don't want to take their medications every day. They have a busy life. They don't want to remember. They don't want side effects like gaining weight and all those stuff. So that's when rectal route are used, right? So I hope it was easy to understand. If there are any questions, please feel free to ask and I'll try to help you. Thank you. Have a good day.